Hello, all here. I have Lauren Reinhart here. Is it okay to interview you?
Yep.
All right. So, we're going to be discussing courage today and the common good approach and what we are as advocates to our patients. And we're going to discuss when we get in a rush and how we need to slow down and how you feel about that when it comes to physicians or other people who are trying to hurry these patients and what it does good for our patients to just take a little more time with them.
Sure.
I just want to start before I have any questions. How do you feel about the time that we spend with our patients?
Um, it's probably the most important part of our job because, especially in our procedural area, our job is relatively task-based, except for those interactions with the patients. And those interactions with the patients are the points at which we're building trust, we're building comfort with the family, with the patient, and we're kind of setting the stage for their entire experience. They're not going to care how we scrubbed a particular way or what method we use to manipulate the wires and catheters that we use, but they are going to care about the way that we made them feel. And if we didn't make them feel safe and secure and comfortable and in good hands, they're either going to go to another institution or they're going to potentially stop seeking routine care for their defect or their condition. And for our area specifically, we work with kids who have congenital heart defects who need lifelong care. And so this isn't just a once little blurb in the hospital. This is a part of a continuous scheme of care and follow-up and prevention to keep them from getting sick and having a shorter life in the long run. So if our interactions with our patients are negative or traumatic or hurtful or in any way causes them distress, we could potentially be shortening their lives by leading them down a path where they stop seeking health care for the things that they need to live and to be safe and to have a happy life.
So, what if I told you that according to the NIH.gov, 1/3 of physicians with a high rate of malpractice claims had spent less than 10 minutes with a patient, and compared with only 12% of patients that had seen them over 10 minutes had no malpractice claims? What would you think about that?
I would think that it makes sense in a way. The longer you spend with your patient, the more that you get to know them, the more details you'll get about their situation, the more you'll be able to incorporate that information, the health history, the history of their particular individuality within their defect or their case, and be able to incorporate all the information that you gather from them to have a more successful procedure or medical intervention, whatever it is that you're performing for them. So it would make sense that there would be less malpractice claims because you've gathered more information about your patient. But on the other side of things, the more time you spend with that patient, the more they learn about you, and the less you become a white coat and the more you become another human who's trying to help. Human error is inevitable, and unfortunately sometimes it leads to really horrible outcomes for people, which is terrible and sad, and must be, I haven't experienced that myself, but it has to be just horribly difficult for the families to deal with, when something you've done has either caused a death or an irreversible injury or some sort of consequence that's going to live with that patient for the rest of their life. So the more time you spend with them, the more you become that human for them, and the more they'll trust you, but also the more I believe they'll be willing to understand that you were trying to do the best you could. And we all make mistakes, and being transparent and honest with people and connecting with them on a personal and individual level is incredibly important in healthcare, because you might be that person making that mistake, making that action that leads to to some horrible, or not even horrible, but annoying consequence for that patient. And if they don't feel like you were at least trying to do the right thing for them, I can see they go file a malpractice suit. He was an asshole, so I'm gonna get some money out of him for what he did to my family, you know?
So my paper on this is based on moral courage. Can you tell me, based on, I'm doing mine on rushing and not taking that extra time with patients. Have you ever experienced where you're rushed and you had to show courage to somebody else just by taking that extra time? And can you explain that?
So, in our area, unfortunately, that's something that is a real problem, and it makes sense that you're writing your paper on it because it's something we deal with every day. You know, healthcare in general is changing from a medical necessity to almost a service industry in a way. You know, people expect service, they expect it fast, they expect it efficient, and because of all that, our management and our CEOs and the hospitals and the way that things are moving in a direction of, you know, NPs in the clinic. My understanding is that they see 20, 30, 40 patients in a day, and so you put that many patients in, you take away that time to have with that patient, which, like I said, from my belief system, is incredibly important. So the amount of time that I have as a nurse with my patients before they go under anesthesia and before I separate the children from their families is a matter of minutes. And those minutes are the most important part of my day, because I not only have to generate trust and comfort with myself, but I have to generate a level of trust in the physician. So it's my job to make that family feel that they've made the right decision. They've made the right choice to come to this institution. They've made the right choice to have this provider do this really important procedure on their kid. And if I just breeze through that and say, hey, I'm Lauren, I'm going to be taking your kid back for the day, blah, 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 do you have any questions? No, okay, good. That's doing that family a disservice. It's doing my physician a disservice, and it's doing me a disservice, because when I call them and give them updates during the procedure, if something bad happens, they're not going to be able to relate to me at all. I'm going to be some robocaller saying, hey, by the way, your kid arrested during the procedure, sorry about that. They're not going to be able to hear it from me as human to human, individual to individual, and that's going to leave them very alone. And on the other hand, side of things, not just for the family, but for the kid, you know, it's easy to breeze through when the kid's being held by their family to say, oh, we're going to be taking you back today. Are you happy? Are you comfortable? Like, are you ready to get this done with? And they're going to say, yeah, I'm ready to get this done with, while they're holding their mom and dad, or, you know, sitting on the bedside with them. But you're going to separate that kid from their family, and, you know, teenagers can handle it a little better, but we deal with kids all the way down to, you know, infant ages. And so you take a 6-year-old away from their family without having established any trust with them and spent any time with them, and they're going to get back to this procedural suite and be the most alone they may have ever been in their entire life, surrounded by people who may not even be, you know, looking at them as a human individual, just seeing them as the patient, you know.
So we're taking this on our jobs every day, but as what I'm hearing you say and how I feel, those extra minutes and time really benefits a patient and their health.
Yeah, I believe so. One of our surgeons, interventionalists, I was having a conversation the other day, and I don't have specific information on it, but our area just hired a neurologist who also specializes in cardiology, and that person is researching the trauma and the PTSD that these kids are having, because sometimes when you get a kid back here, you have to get them to sleep, no matter what that means, and sometimes, unfortunately, that means holding them down and putting gas to their face so that they can breathe in and fall asleep, even if they're crying, even if they're screaming, because at that point you haven't built enough trust with them to be able to soothe them, and you're scary, and that's traumatic. And like I said, I truly believe that, you know, some of these patients who have non-compliance, don't adhere to their follow-up plan, cancel their cases. I truly believe part of that is a lack of trust and a lack of comfort with the care team and how they've been treated in the past and what they expect their day to go like when they come in.
Have you ever been faced where you had to tell a doctor, another nurse, another staff member, where we just had to slow down? And in that situation, what was the result?
So it happens pretty often that I need a little bit more time with a patient to completely go over all the details of their procedure with them and their family, to answer all their questions, to build that rapport and that level of trust. And our area is all focused on efficiency, and so, you know, the CRNA and the anesthesiologist, they're popping their heads in the room saying, hey, are you ready yet? And I have to tell them no sometimes, and that comes back to me and comes back on the nursing team because there's a delay and Lauren was the cause of it, and that's seen from a really negative perspective from staff to staff, because efficiency is key. The more cases we can do, the more money we can make for the hospital, the earlier everyone can go home, but that's thinking about yourself and the institution and not the patient. And so in those cases, most often people will give me a few extra minutes. Sometimes they won't. Sometimes they'll say, you've had enough time, we're doing the turnover, the timeout, and the handover now. And I miss out on those opportunities to communicate with my patient and their family, and it honestly shows. You'll get back here and you'll have these more difficult inductions where kids scream and they cry and they thrash and they try and hit you and they try and get away because they're scared. And so when I don't get to spend that time is when I see that a lot more. If no one else made a point of trust and made a connection with that kid, as long as one of us did, which usually falls on their nurse, we can at least be that person in there with them while they're scared, who says, do you need to hold my hand? Do you need to talk about it? What are you most nervous about? I'm here with you the entire time. I won't leave you. You know, and when I get to spend that time building that relationship, those comments and those outreaches of emotional availability, that makes the biggest difference for the patient. And that's where, even if they're scared, they can hold on to you as they fall asleep and the tears kind of stay at bay.
Lauren, I appreciate your time, and thank you so much. This
Yeah.
will really help out.
Great, I'm glad to hear it.
All right, I'm gonna let you go.